from 38 different counties. So you can see that the process that we went through was indeed fairly rigorous, and to be one of 10, I think you can take a great deal of pride in that. Mr. Chairman, if you would join me, I'd like to acknowledge, first of all, the Healthy Kids Mendocino program. The major theme among our challenge awards this year was to look at those collaborative type of programs or those partnership programs, and this is it typifies the whole thing. Lack of health insurance and subsequent health care for children is a growing problem throughout the United States. As you know, this impact is felt throughout our community. When kids are sick, our schools don't get the funds, our hospitals are overcrowded. They may or may not get reimbursed if the family does not have insurance. Our whole community suffers when kids don't have insurance. Healthy Kids is a public-private partnership with a mission to ensure that every kid in Mendocino County indeed has health insurance and access to health care. Our judging panel is extremely impressed with the network of collaboration that takes place in this program and the success that this program has already demonstrated in Mendocino County. So, Mr. Chairman, if I could, I don't know, is Carmel Angelo, the Director of County Health and Human Services, here?
Yes.
Okay, Carmel, come on. And Stacy Cryer, the Director of Community Health Services for the HHSA?
Yes.
Well, without further ado, here you are. Says California State Association of Counties 2008 Challenge Award, Mendocino County, Healthy Kids Mendocino. And after you wipe all my fingerprints off of it, you can probably display that. So congratulations.
Paul, we'll need you to turn around. There you go.
It's hard to hold.
This is a happy event.
Well, here's the box too. So.
And Paul, one other individual that's extremely critical to this is Ann Mulgard from First Five Mendocino. So
yeah, I've got some others, Mr.
Oh,
Dunbar.
okay.
First Five Mendocino, represented by Tammy Scott and Ann Mulgard. Mendocino County Office of Education, represented by Laura Bynum. United Way, Regional Manager Bob Jordan, and the Alliance for Rural Community Health. I think, the collaborative aspect of this, you can't just forget all those community agencies that were also involved.
If I could invite those folks just mentioned to please come forward for a picture. Is certainly warranted and welcomed. David, you still on First Five?
Yeah.
Would you like
Get
to
down
be in the
there.
picture? Please.
Any opportunity to be?
You bet.
I'm tall, you won't. And I want to just congratulate you again. Obviously, the Board of Supervisors had a significant role in this program as well, and you're to be commended for this program. So congratulations.
Thank you, Paul.
And thank you, Paul, for making the trip over here to make that presentation. And this is the first time that the awards have actually been presented in the county in which they were won, and that's it's a big change, and I think it's been a very successful change. Thank you.
I'd also acknowledge that the descriptions of this program are printed in a book that we'll be handing out at our annual meeting, and then it'll also be posted on our website, so other counties will have opportunity to review the program that you've put together and contact your people and bug the heck out of them so that they can duplicate it around the state. So, thank you very
Paul,
much.
and I do believe that literature arrived in our mail yesterday.
Good.
Here at our offices, and so it is available. And if I can chime in, I'm not very often ringing my own bell, but Supervisor Koufax and myself were attendees of the very first formation meeting of the discussion of the creation of this with Ms. Ann Mulgard, and I stand committed today as much as I was then. It's a great program and takes care of our kids, and I believe Supervisor Koufax would say the same things.
Absolutely.
And it's great for our community.
Thank you, Mr. Chairman.
Thank you.
Thank you.
Supervisor Pinchas.
You know, what's kind of ironic in all of this is here in Mendocino County, probably one of the I wouldn't say poorest county, but the counties with the least revenue, whether it's personal revenue or county dollars available. Between the Healthy Kids program and the prescription drug program, we have probably done more to promote the health care of our citizens than I would put it up against any boundary area in the nation. So it's really a bright spot, and it's really
We can do it.
this board, and not only this board, but previous boards, it's been a real legacy and for all of my colleagues here, and you need to pat yourselves on the back, because when you really look at it, it's probably not going to get any press or hardly any press, but it's a real step. Everybody talks about better health care and, taking care of. We in this county, with the limited resources, have come together and done more with those two programs than anybody around. It's really a huge story, and there's a lot of people involved. I mean, you can't just name like First Five or all these organizations and everything, but we've come together and done it, and it's really a bright spot that doesn't really get shined upon the way at the level it should be.
Good comments. Thank you, Supervisor. Supervisor Smith, you have a comment?